having those conversations with the doctor about how it's affecting your daily living, being specific about how you're having difficulties with dressing or walking or preparing a meal or eating a meal, even cutting up your food appropriately, different things like that.
Hi everyone, welcome back to this week's episode on Take a Pain Check. I'm so excited to have Carol joining me today. Hi Carol, can you give me a brief introduction about yourself? Tell me a little bit about your education, your hobbies, even what you do in the workplace, and what you've been up to recently.
Absolutely. Great. And thanks for having me, Natasha. My name is Carol Mayer, and I work with True North Disability Services as a business development manager. And previously in life worked in dentistry for a very long time and decided at some point that we needed a change. And here I am. But have recently moved to Kelowna, British Columbia from the Lower Mainland. And anybody that lives out that way knows that sometimes the rain can get to you. And so it instituted a move for us and allows me to reach a different group of people and work in different aspects with volunteer organizations and things out here. So that's something that's very near and dear to my heart. And so excited to explore those options.
Yeah, that's amazing. I mean, I've only been to BC once or twice, and I've always felt like I needed to stay there longer because there's probably so much to do. I've never
Oh,
been
yeah.
to Kelowna before, but
Oh, you'll have to come out.
yeah, hopefully soon. You were previously in the field of dentistry, like you mentioned. What sort of experience did you have where you felt as though you wanted to make a switch in your career?
hmm And I've worked for a few different offices and they're all run very differently. And in the last number of years of my career, I was working for a bigger organization and realized that's just really not where I wanted to be. It wasn't a personalized approach that they had to their patients. It felt like they were more of numbers, and that didn't sit well with me. And they didn't appreciate the staff. And we worked really hard for those doctors and for our patients, and it wasn't something that they seemed to really appreciate. So I thought, you know what? I got to do something different for myself and my family, and looked for something that was in another capacity able to help people in some way. In dentistry, I always advocated for people with their insurance companies, making sure that we could get everything from the insurance company that they should be paying. And when I saw the listing for True North and read about what they were about and that it is another avenue where I could help people, that was something that I really wanted to explore further, and found out how fantastic a organization they were and how much they do appreciate their staff. So
That's amazing. Thank you so much for sharing that. And I know insurance is such a big topic, whether it be a patient that's undergoing any sort of dental procedure, but then even in the certain fields like rheumatology or any other medical field that patients are going through, there's always problems with insurance. I mean, I've been experiencing that recently. So I really appreciate you advocating for patients and helping them out through that.
yeah, it's amazing. We always have to come down to the point that you're dealing with people. There's people behind these insurance companies. There's people behind anything that we do, and people can make mistakes. And they do make mistakes, and they just have to be held accountable when those things are done so that they can be corrected.
Yeah, one of the mistakes that I recently faced was when I think my dad's date of birth was entered incorrectly in the paperwork. There was a big delay in terms of when I got my medication because of that.
Oh
And I
gosh,
had
yeah.
no idea that that was going to happen, or even now I'm kind of just still waiting on my medication. I'm going sample to sample and not actually being supported by insurance because they're waiting for authorizations and all these different things. And it's just scary as a patient, kind of thinking about just waiting for your medication, whether it'll come or not in a couple of weeks, and just being so uncertain about your healthcare. And so it's so interesting to hear from you and what the work you've been doing is.
It's very important to me, and to see people getting what they deserve and what they're entitled to. When I see them being affected in a way like you have been with your medication, that just gets me going, and I just want to work harder for someone.
No, I appreciate that. How does your previous work really help you to understand the struggles that individuals in your current field have?
In the dental field, we had a lot of times where people came in with different health conditions. And so we always talked about how those health conditions affected, how we would treat them or what we were able to do for them. And dealt with a lot of different people with a lot of different things. So it was really eye-opening to see it from the perspective of the disability tax credit and how I wish I'd known about that years ago to talk to people about it and make sure they're aware that they could potentially qualify for it.
And I guess
But
since you've already sort of started us off on the topic, a lot of patients don't really know what the disability tax credit is. So would you be able to explain what it is and how it would be able to help a lot of patients?
yeah, it's something that it seems like there's groups of people that know about it, and then there's this other big group that haven't heard the first thing about it. And really what it is a tax credit available through the Canada Revenue Agency. They're the ones that administer it. And it is in place to reduce the amount of income tax that someone is obligated to pay. And it is also retroactive up to 10 years, which is absolutely fantastic. And it's available to those who have suffered in the past or currently suffer from a medical or physical impairment that has affected them for at least 12 months or longer. So sometimes we have people come to us that have just been newly diagnosed and they've heard about this credit and they just want to jump and get on board with it. But Canada Revenue wants to see them experiencing the condition for at least 12 months.
And so does this apply to anyone with a disability? What is the paperwork or the process like to apply?
Yeah, and that's the big thing that I think a lot of people get hung up on is the word disability, because in a lot of cases, people don't consider them to be disabled. In situations, with a lot of the arthritis type conditions, it's definitely affecting their daily living, but not to the point in all cases of being in a wheelchair or something a little more physically visible. So people need to understand that really what Canada Revenue seems to look at the most is a time factor. The amount of time it's taking someone to manage a particular condition out of their daily living. And when that's significantly affected, that's when they can qualify for that credit.
That's really interesting, and thank you for sharing that. And I guess in terms of how much money that people can actually expect to save with this credit, do you know how it works in terms of that?
It is different in each province because, of course, this is a federal tax credit, so it's available across Canada. But there's the federal portion of it, which is set. Everybody gets the same amount for that. And then there's the provincial portion, and that varies by province. So Alberta is one of the highest paying provinces. BC is a little bit lower. Ontario is kind of middle of the road. So each province gets a little bit of a different amount, but it is based on the amount of income tax that you've paid throughout the years. And so the more income tax you've paid, the more of the credit you are able to use. But if you haven't been paying any income tax, maybe you've been younger and not working, or you've been unable to work because of your condition, then you may not be able to use any or maybe just some of the credit. And so then what they allow to happen is to have the remainder of the credit transferred to a supporting family member. So if you have a mother, father, brother, sister, aunt, uncle, niece, nephew that's been helping you in some way, in the way of food, shelter, or clothing, and helping you consistently with those things throughout the years, then you can transfer the credit to their taxes and help that family member save on their taxes.
Okay.
They've been helping you.
Yeah, that makes sense. And I think I am enrolled in it. My dad kind of helped me enroll in the whole process. I definitely see where if you don't have that employment or those incomes, then the person that supports you can also benefit from it to help you out. And so that's just something great to hear that that's also an opportunity. Because, I mean, as a person with lived experience, I would never think that this is something that exists. Or also, I think there might be a lot of stigma around it. Why do I want that? I mean, people are going to think of me as disabled, me getting my life easy. Lots of people think about that very often.
Or they think it will affect their employment or their driver's license, all different things. And really it comes down to it's available to the Canada Revenue Agency and your doctor, and then whoever you choose to share that information with. But it doesn't have to be something that's shared.
You said you're part of the True North Disability Services based in Surrey, Canada. What is your role there, and what was the process into getting into your position, and what do you do currently?
Right. So I started out as a client service representative, so they're the ones that do the initial intake with the client and go over how they're affected by their condition to see if they may be meeting the criteria of the credit. And then after doing that for a while, they moved me into a management position where I started to manage that department as well as the department that deals with the doctors. And then those got too big, and we went to just one department and managed them for a few years. And then just last year moved into the business development role. I'm one of their, actually, I think I now am their longest standing employee. So 8 of the 10 years that the company's been around, I've been with them. And so know pretty much every department inside and out. Used to do all the hiring and training of the staff, which was really neat to see people learn and grow and be able to help other people with the disability tax credit.
That's amazing. I'm wondering if you could share some stories on people that you've helped and, maybe some fears that they might have had when they started going through this process and what some of the outcomes may have been, or any sort of experiences you've had working with people and their experience with the disability tax credit.
Yeah, it's been very rewarding over the years. I specifically remember one family that I worked with. It was a mother and a child, both with different disabilities. And the end result, they got probably between the two of them about $60,000. And she was just in tears when the refund came and said, there's so many things that I wanted to do for my son. I think he had autism, and programs and things that she wanted to put him into that she could never do before. And having this lump sum has just opened her eyes to so many more things that she can do for her child. And that was quite a rewarding one there. And then more recently this year, we had a client reach out to us who we'd left a message for about the payment coming from Canada Revenue. And she says, I have been just living from paycheck to paycheck, barely able to make it by. I just had my last thing in my cupboard was a package of couscous. Like, this is my last thing I had. And we told her she was getting, I think, $9,000 or something. And she's like, I could buy a cantaloupe. And we thought, oh my gosh, like, it's just sometimes those simplest things that we take for granted that people look forward to being able to do when they get this money. Or someone who was living on the streets, and she had been going into hospital or into different shelters and things just to have somewhere warm to sleep. And we were able to let her know, because she wasn't always on the street. She had previously been employed. So she did have a taxable income in the past, and we were able to get her this lump sum of money that was going to give her a place to sleep that night and many nights into the future. And that's really the most exciting things we can do, is see what changes it makes in people's lives.
So, in terms of if someone is enrolled in the organization or the services that you provide, what are those services that you offer, and how do you help people with disabilities in particular?
Yeah, so a lot of times people, when they're dealing with a health condition, they don't have the bandwidth or the mental capacity to deal with all the ins and outs of this tax credit and dealing with their doctor and all of that sort of thing. And even having their doctor listen to them sometimes is difficult. So when we do the assessment with them, we use that information to create an example for the doctor that exemplifies how they're meeting the criteria of the tax credit. That way it helps the doctor know how to say what it is they need to say about the person, because sometimes they want to get all clinical and be very number oriented and reports and things like that. But they have to remember that Canada Revenue aren't doctors, right? They're not used to reading all this medical jargon. So we put it more in layman's terms for them and make sure it's something that Canada Revenue can recognize. And then once the doctor fills it out, if there's any mistakes or any problems, then we go back to the doctor and make sure that gets fixed, so they're not, clients not missing out on any of the tax years that they should be entitled to. And then we make sure we watch it through with Canada Revenue Agency. Right now, they're doing a thing where they're coming back to the doctors asking for more information twice as often as they ever have before. So that's been a big change. And very often the doctor gets that form, they hate paperwork. And so they read through it quickly, fill in the blanks, and they send it back. Well, they're not realizing that in the text of that form, sometimes the Canada Revenue Agency is asking for medical records. And they're just filling in the blanks. They're not sending back the medical records. So that's delaying the claim even more, sometimes not allowing them to come to a decision. And so we make sure that that's answered fully and completely and gets back to the Canada Revenue Agency in the time frame that they allow. and gets them on their way to that approval. And then we have to wait for the request that we put in for the tax adjustments to be done. And then we make sure we follow those through and that they get those done correctly. And if there's a mistake, we make sure that gets corrected with Canada Revenue. And we do all the hold time for the doctor's office and the Canada Revenue Agency for people, because it's a lot of time it takes to get through to those organizations and make sure that things are done appropriately.
Especially when you're living with a health condition, there's so many other things that you need to think about, and this is just one more thing. And I think that that's why a lot of patients tend to just not bother with the disability tax credit, because they're just thinking there's one more thing I have to do related to my health, and I don't want to do it. And so
Exactly. Or
I'm
they give
glad
up.
that there are services out there where people can support you and help you through that process, because at least for me, I have my dad to help me, but I think a lot of people don't, especially our audience that take a paycheck, being youth and young adults. They might not have the capacity or know the knowledge to be able to fill some of these things out. And so having an organization like yours who kind of supports people with lived experience is super helpful.
Yeah, and it's, there's the odd case where people can apply and have no problems. You just don't know when the problems are going to occur. It's kind of like having an insurance policy. You just hope that you never need it, or you hope that things go okay. But to know that you've got someone there that's got your back, that's going to make sure that you get what you're entitled to, is quite valuable.
Working in this role for a couple of years, how have you seen things change in terms of people's perception on the disability tax credit?
I think people are getting a little more educated about it than they have been in the past, especially mothers. Mothers tend to do all the research, it seems. But people are getting to be a little more familiar with it and aware of it. But knowing the ins and outs and how things qualify is still something that I think people have a hard time with.
And do you provide any resources or knowledge, or do you have any sort of recommendations or people can learn more about the disability tax credit?
Yeah, it's always something that I recommend people looking at Canada Revenue's site for. We do have information on our site about it as well, and other programs that become available to people once they get approved for the disability tax credit can also be really helpful. There is, for like a younger person situation, because it is retroactive up to 10 years, you can also go retroactively for the child disability benefit. So parents usually get the child tax credit, and this is a supplement to that. So it's a monthly amount. And it can amount to thousands of dollars as well for someone. So that's life-changing. And it's ongoing as well. Like with the disability tax credit, usually they approve people 5 to 7 years into the future. And in some cases, they'll also do lifetime approvals, which is amazing. So with the child disability benefit added onto that, you can see significant refunds.
Can you clarify a little bit about what are the different categories that people can apply to?
Yeah, so with the disability tax credit, they look at our 8 activities of daily living. So there's your mental functions, your vision, speaking, hearing, feeding, which is preparing a meal and also consuming a meal if you have difficulties in either or both areas. Also dressing, elimination, so using the washroom, and then walking. And then they have also a separate area which is called life-sustaining therapy. And that's where sometimes, I don't know if you've heard, where diabetics may be able to qualify for the disability tax credit. That would fall under life-sustaining therapy, as well as kidney dialysis. And there's some therapies for hemophilia that can qualify as a life-sustaining therapy as well. So with the rheumatoid arthritis and osteoarthritis and the juvenile arthritis, we see a lot of times qualifying in the walking and dressing categories, and sometimes feeding as well.
Yeah, I see that as well. I mean, for myself, it's been a journey, and I think maybe going back a while, it was definitely worse in terms of being able to dress and walk. You know, I'm still in pain and struggle sometimes, even kind of making food, cooking, lifting up objects. Those different things are definitely challenging. So I'm sure multiple people listening to the episode probably resonate, and they're like, this is something that I also can't do. So it's something that hopefully they can look into. We talked a little bit about some of those like misconceptions that patients do have, and that's why it kind of steers them away from the disability tax credit. Do you know any other challenges or misconceptions that patients have experienced in the time that you've kind of worked with the disability tax credit?
Yeah, there's been different things. a lot of it comes from the doctors too. Someone will go in with the forms. Even one of our owners started this company because he's diabetic, and he had a friend who worked for the CRA say that he should apply. His doctor looked at the forms, threw them back at him, and said, "You don't qualify for this. You're not in a wheelchair." And people think that the doctors know what they're talking about. Most of us just trust what the doctor says. And that's certainly not the criteria, but the tax credit has changed over the years. So they can't be totally held at fault. Things have evolved and they just haven't followed along with the evolution of the credit. So way back when it first started 30 years ago, you did have to be more severely affected. But that's changed over the years. People also think that it might affect their eligibility for other programs or might affect their income from other programs. And really it's treated as if it is a tax refund, so it's not considered to be income. And so it won't affect things like that. Those are the two biggest ones I think we hear, or someone sometimes thinks they make too much money to be able to qualify, which is not the case. You can't make too much money, but you make too little money where you're not paying income tax, and then you wouldn't be able to benefit financially from having the credit.
That's great to hear. Thank you for clarifying some of those misconceptions. So, for individuals with rheumatic diseases or any sort of health condition, do they need a certification for their condition? What are those types of paperwork that they might need when they are talking to their healthcare provider?
Yeah, so it is something that they do have to have talked to their healthcare provider about, of course. It's great if they have a diagnosis, but even then, it can go back farther than the diagnosis, because a lot of times people don't get diagnosed right away or know what it is that's causing them their difficulties. So if the doctor can document how a person has been affected even prior to the diagnosis, you can usually go back to that earlier date. But it is a matter of having those conversations with the doctor about how it's affecting your daily living, being specific about how you're having difficulties with dressing or walking or preparing a meal or eating a meal, even cutting up your food appropriately, different things like that. And making sure that those medical records are available to the doctor, especially if you've changed doctors over the years or you've been at the hospital. You want to make sure those records are available to the doctor that's filling out the application for you. Very often we talk to people and they said, "Oh yeah, I've only been at this doctor for 3 years, but my condition goes back 10. And we go, "Okay, well then we'll try to get those 10 years for you." They think the records were transferred, and really it just never happened. It was requested, but the records never made it to the new doctor. So then that kind of puts a delay in the whole application process. So making sure that your doctor has all your records to support your claim is quite important.
And then, if an individual were to complete an application by themselves, how long does it take to get processed?
Depends on, well, first, once the doctors fill out everything for them and they submit it to the CRA, there's different time frames involved depending on the time of year. So on their website, they'll say about 8 weeks for a review of an application. And right now, between July and November, we see it go to 11, 12 weeks, so about 3 months versus the 2 months that's average the rest of the year. So the time of year will determine how long it takes a bit. And the review of the application is just one part, and then it's the reassessment of their taxes to put the disability tax credit on their taxes that can add another 3 to 6 months to the process.
Are there common mistakes that people make when they do their application, and so that's why maybe it might take longer?
Yeah, I mean, a lot of times the doctors aren't providing all the information that Canada Revenue is asking for, in which case they'll most likely go right back to the doctor and ask for more things, or they just might outright deny them. Sometimes the doctor's writing isn't exactly legible, and Canada Revenue will make mistakes on the approval because they've misread what the doctor has said. And if people aren't paying attention to that or questioning why they haven't been approved for all the years that they should have, that might not get corrected.
And then, say someone has submitted their application and it's in place and they're getting the disability tax credit. Is there an expiration, or do they need to resubmit forms at a certain point of their life?
Yeah, so when they get approved, it will tell them the years that they've been approved for. And it's a little bit misleading because a lot of times the review will say they've been effective for 30 years. the approval will say you're approved back those 30 years and into the future 5 to 7 years. And so you don't have to reapply for 5 to 7 years. But when they look at that approval date, they think they're going to get money back for all those years that they've been affected, but they don't, because they can only get the tax credit applied to their taxes back 10 years, not the full 30 years.
It really just depends, I guess, case by case, and there's no certain time limits or expiration for the
Yeah,
claims.
it really depends on what the doctor says on the application. Sometimes the doctors will say, well, they're having a hip replacement in 2027. I think they'll get better after that. And so then the Canada Revenue cuts it off at 2027. So it just depends.
And then, do you have any recommendations in terms of what documents patients should keep for future reference? Say there is more communication that needs to happen going forward, if there was like any miscommunication.
I would always keep a copy of the application that was submitted to Canada Revenue. The doctor should give them a copy. They don't always, but make sure they ask for that so that they know what's been said, and review it before the doctor sends it into the CRA, because if you see something that's been done wrong the year that you've been affected or something to that effect, then you can address it with the doctor before it goes to the CRA.
Okay, so it's the doctor that submits it to the CRA. It's not the patient
It
or you.
depends on the
Okay.
doctor's office. Some of them will submit it for you, and some of them just give it back to you to submit. But yeah,
Okay.
definitely always read that over before it's submitted to make sure everything is reflective of how you are affected and how long you've been affected.
Amazing. So, is there anything else you'd like to share about the disability tax credit that maybe we didn't cover?
Well, once you do have the approval for the disability tax credit, it opens up avenues for other programs. So you have to have that approval in place first, and then you can get what I mentioned before with the child disability benefit. And then also really important, especially for someone who's younger or under the age of 49, is the Registered Disability Savings Program. So it's kind of like you always hear of RRSPs or RESPs. So this is the Registered Disability Savings Program. You put money into that program, and the government can match up to 3 times the amount that you put in the form of grants and bonds. So it grows exponentially and can be a lifesaver later on in life.
So, is this specifically for people with disabilities, like that specific program?
And only if they've been approved for the disability tax credit. Those are the 2 main programs that we help with. There are other programs like the First Home Buyers Plan. You don't have to be a first home buyer to take advantage of that when you have the disability tax credit. There's certain medical expenses and therapies and stuff that can be claimed as a medical expense when you have the disability tax credit. Certain renovations to your home, if you have to put in a ramp or just wheelchair accessible things, or just can be different things. You put in a suite to have your child live with you because they have a mental function issue where they can't live on their own. Different things like that. There's advantages in those programs to having the disability tax credit as well.
Okay, so I wanted to talk to you a little bit about your personal initiatives and interests. So, first, can you walk me through a day in your life and what you do in the workplace?
Yeah, so my workday starts at 8 in the morning, as most people. So I start with connecting with different organizations that deal in health conditions and making sure that their members are aware of the disability tax credit and what's available to them, and help with different information being available there, and working with our different departments in the company and making sure that I'm on top of what's happening in those different departments and what difficulties they're having, sometimes with doctors, and making sure that they're getting educated in the right way. So we're reaching out to different health organizations. And then once my workday is over with, then I'm doing some volunteering with the Seniors Society here in Kelowna and connecting with seniors that are lonely or needing little things done around the home and things like that. So my fiance and I are working together on that and loving it.
That's great. So, how do you advocate for individuals outside of your work with the disability tax credit?
I'm always talking about it, making
Okay.
sure people are aware that it's there. But I donated a kidney in 2013. And so I've been working with different kidney organizations and volunteering with those and helping different people understand more about the kidney transplant process and what's involved in that.
Is there any reason why you're so passionate about healthcare and the health field? I'm just so curious because,
I know.
yeah,
I,
dentistry, kidney, then there's like the disability tax credit. You are really passionate about that. And I just wonder, where did that come from?
usually it's because somebody in your family has had something happen, right? I had a family member, she's more of a like a second cousin who was born with a health condition. She had a colostomy when we were a child. And she had a surgery at some point due to her health condition, and she had one good kidney. And during that procedure, her good kidney was damaged, and she ended up in kidney failure. And her brother-in-law donated a kidney to her. And this was like probably 30 or 40 years ago. So, really early in the transplant process. And so when I decided that I wanted to donate a kidney, we talked to her mom and her and just make sure, is everybody still doing okay? Is he doing okay with one kidney? Are you okay with one? And everybody was doing great 30 years later. So I thought that was an opportunity to help someone in a way that you don't get an opportunity to do very often.
Yeah, thanks for sharing your story in terms of why you're passionate about healthcare. I wanted to talk a little bit also about, we discussed the instances where you felt like your work has made an impact on someone's life. You gave a couple examples, but what would you say is the most satisfying and rewarding part of your job?
Just seeing a difference in people's lives and hearing the stories, like because I don't get to deal directly with the clients anymore, we have a chat for our office where people put in their experiences and the comments that people give and say, and that's what really keeps me going, knowing that we're making a difference for people. When I worked in dentistry, I worked for an insurance company for a number of years and dealt with the dental claims on that side of things and learned about how dental accidents are handled. And so then I went back to dentistry after I had my daughter and dealt with someone who'd had a dental accident, and he was at work when it happened and dealt with the insurance companies, went advocated for him like crazy, went back and forth and had, I think, all of his procedures covered 100%, which he normally only would have had 50% for. But it was learning what I did at the insurance company to come back to dentistry and be able to apply that there and advocate for someone in that way. It just, every time I see anything that I can do that's making a difference in someone's life is where I get my energy from and what keeps me going.
So, what advice would you give to those who are interested in applying to the disability tax credit for a family member?
Just being first ready to apply, being sure that you have all the information with the doctor's office, all the medical records that are there, and that the doctor's on board to support you. Some doctors, they almost seem like it's going to be money out of their own pocket, but they really don't have the right to deny you filling out an application. They are there to report how someone is affected, not to determine the eligibility for the tax credit. There's 8 million people in Canada reporting a disability over the age of 15, and only about 17% of them have applied for the disability tax credit. So there's a vast undervalue there. With the application process, it can be daunting, it can be frustrating, but just stay with it. It'll be worth it in the end. And if you need help, just know that there's people out there that will help with the application process.
Amazing. So, thank you so much, Carol, for joining me on today's podcast episode. We talked a little bit about your career from dentistry to then advocacy, and then you talked about the disability tax credit for individuals in Canada and what it's like for individuals to be eligible for the program. We then talked a little bit about True North Disability Services, discussing what they offer And then you discuss your passion about advocacy and how your work really aligns with your goals. We talked about some misconceptions about the disability tax credit and then specific considerations for those with rheumatic diseases. And then we talked also about the application process and a little bit going off from talking about disability tax credit. We talked a little bit about your own personal wins and how you've seen others benefit from your work. So everyone, like, comment, subscribe, check out the True North Disability Services, which I will link down below. And I'll see everyone in 2 weeks on Take a Pain Check. Thank you so much.
Thank you, Natasha.